And this is should be very informal. The crosses are very formal people, so address them by their proper names. But I'm just teasing. Meredith is a star of the show. She's here on the end. So last June, the 25th, Meredith was riding her horse, and then I want her to tell you guys what happened, and we'll talk about how she came to meet me. You're riding a horse. Were you wearing a helmet?
No, I was not wearing a helmet. Well, it was on the 25th of June. I was riding a horse with one of my really close friends. His name was Casey, and we were trying to go back because the horse was acting up anyway, and so a car drove by and spooked the horse, and the horse started running, and I fell off. So that's all I really remember. So.
And we have some EMS folks here from Rockingham County.
I'm Tim Shelton, paramedic with Rockingham County.
I'm Marcy Smith, paramedic with Rockingham that ran the column area.
And
Then we got on scene, as we were dispatched to the call, we were told that there was a trauma involving a teenager that fell off of a horse. We had an extended ETA to get there, so we discussed among ourselves to go ahead and notify air care because just with the information we were initially given, she was going to a trauma. She needed a trauma facility. So once we got there, she had fell off a horse, rather large horse. I mean, they're tall. Compared to me, they're tall. And she had landed on a concrete surface. She was having some seizure activity prior to us getting there, and she was having some activity when we had got to her. We had several guys from the fire department. Our biggest things when we got there, we wanted to make sure she had a good airway, which she did. Give her 100% O2. We had to control her C-spine and stop her seizure activity. So that was the biggest thing. We had a 10-minute on scene time, which for a trauma with the situation that was killer. It was very good. And so by the time we got her loaded on the way to meet air care, they were already landed and on the ground. So we had an excellent turnaround time for her. So that was pretty good.
it's so a couple points there. We talked about concussions this morning. If your son or daughter is out playing sports and they bump their head and they start having a seizure, does that mean that their head injury is any worse? No, it doesn't. Seizures are scary and everyone freaks out, I'll tell you. Parents, everyone, when someone starts, but a post-traumatic seizure initially at the time of the head injury does not mean that it's any worse or better than one if you don't have one. But the fact that Meredith has one, that's obviously something that we need to take account for, and the first responders did an excellent job of triaging her, stopping the seizures. That's a big thing. Most of the time they stop on their own, but that's something else. And then the other thing is the big one, which they picked up on right away, was her level of consciousness, or that Glasgow coma score that we talked about. There's 15 points. Remember, three can be if you're dead. So you get 3 just for showing up. 15 for most of us here. And remember, the severe head injury is 3 to 8, right? And so Meredith, on her arrival, when Dr. Pranikoff saw her in the emergency room, was a 7. Okay, so she comes in. We have, obviously, our pediatric surgeons are better than anywhere else. They see her in the emergency room. They appropriately get her up to the ICU. They institute the non-operative things that we can do. So they give her medicine to help decrease the swelling in her brain. They get a CAT scan and get all the trauma series. And this is her initial CAT scan here. And I'll point out, I know not everybody's a radiologist here. So these little white areas, when blood gets outside of the blood vessels and into the brain, it turns white like that because the iron and the hemoglobin absorbs the X-rays as they go through. So this is this salt and pepper appearance. These are the frontal lobes, and we're looking up through her feet. So the left side of the screen is actually the right side of the body. And they put this R here for me, so I can remember that. So front part of her head, here are her eyes and her nose. So we're kind of rolling up. And we see these bruises here on the front part of her skull. Now, where do we think she hit her head? Remember that picture I had this morning? Did she hit the back or the front? That's right. That's right. So this is the classic contra Q injury. So she fell and hit the back of her head. In the brain, remember, like I said, it hit the back part of her skull, and you see there is some blood here, right here, but it's not very much, and it's actually outside of the brain. It's kind of laying around the brain. But really, the blood within the brain is here. And this is a very ominous sign. And so the resident calls me and says that, I've got a little girl here who fell off a horse, and she's got a GCS of 7. The trauma service is going to admit her to the residents. That's like the first thing they want to say, because that's an inside joke between us. But I think they said that actually before they even said her name. But I'll fill you in on that, Meredith. But and I want to put a bolt in. A bolt is a little pressure monitor, so there's no therapy involved with a bolt. It's like a blood pressure cuff. It's completely for diagnostic purposes. If the Glasgow Coma Scale is less than 8, we put this pressure monitor in because the level of consciousness is so they're in a coma, okay, and their level of consciousness is such that we can't figure out if their brain, if that intracranial pressure is going up or down. If you guys are sitting here and I had a little balloon pump and I was able to increase the intracranial pressure, you guys would look like you did this morning, where everyone's kind of just nodding, and our level of sedation would go down. Or our level of awareness. But in someone who's a GCS of 8, we can't detect those things because they're already in coma. So we put this pressure monitor in, which is a small, we can do it at the bedside. We did that in the ICU in Meredith. And right away when I saw this, the first thing I said was, well, am I on call? And I didn't know that I was on call. And the second thing was, yes, put a pressure monitor in, but you need to keep a very close eye on her. Like, I want you to see her every hour. I want to pick you to notify us immediately if her pressures are refractory to any of our treatment. Because this picture, I can tell you right now, 10 out of 10 times it's going to get worse. And so we could make the case right now, why don't we take her to the operating room? And the surgery for this is not to go in and take out those little hemorrhages. The surgery for this is to give her brain more room. So we take the skull off. And you take the skull off wherever the bruising is. And so in this case, and that's become in vogue in the last, we call that a decompressive hemicraniectomy. The hemicraniectomy has really become in vogue because of the Iran-Iraq War. Surgery improves in times of war because you've got lots of subjects. But within neurosurgery, this hemicraniectomy idea and the fact that we take off this part of the skull really has become popular if there's these injuries. Now, I can tell you, older neurosurgeons don't believe in the hemicraniectomy. You might have seen the reporter from ABC. What was his name? Bob what? Bob Woodward, yeah. So if you saw the first interview he had when he came back, he said, if this would have happened to me in the States, I would have died. And I'll tell you, that's the case, because there are neurosurgeons who don't believe in doing this. They think, yeah, there's no science behind it, and I'll tell you there is. I mean, you can see that the nurses in here have taken care of these patients that we do. You'll see the skin stretch because the brain has room to swell. She has a bolt placed. Her initial pressures are 30. We like to see pressures less than 20, and really the big thing is cerebral perfusion pressure, but we won't get into that. But her initial pressures were 30, and with some mannitol and hyperventilation that came down. But as I'll show you here, so this is at 11:23. That scan obviously went from bad to worse. So pressures were initially 30s. They initially responded to treatment, and then they did not respond to treatment. Their pressure curve just kept going up and up and up. And that's the point. Again, we're just using this single measure because we don't have anything else. Now, there's other things we could do. Paralyze Meredith, give her more medicine to really decrease her heart rate and everything, some barbiturates. But in this, I know that none of those measures are going to be effective. And so with this scan that we got, I guess the time was right before midnight. The decision was made to go to the operating room because she was just getting harder and harder to take care of. So she's in a coma. She's got these life-threatening brain injuries. I still haven't met the parents, but I'm obviously communicating with the residents several times, and I say, okay, well, let's get her ready to go to the OR. Tell them I'll talk to them after the case. And so we take her to the operating room, do an incision like this. Did I hurt your skull? I'll try not to break. This is the model. This is actually Meredith's skull. We after the surgery, we take the bone off, and she has a cranioplasty that looks just like this. But the company that made this little model for Meredith. Where do you keep this? Sweet. Sweet. I'm glad. I am glad that things look they're pretty symmetric. Beginner's luck. So, yes.
So when you take that off, do you leave the bone off?
Bone comes off. Sign goes above the bed. Do not touch wherever. Do not put patient on the left side if it's the left side of the skull. Oh, we put it back. We close it. No, that's right. So she goes to the operating room that night. We do our surgery, we take that out. She also there were pretty significant subdural hematomas, so blood between the brain and the covering. We made sure that she had enough room, so we open up the dura, that leathery covering, and actually leave it open and make it bigger so that the brain can come out as much as it needs to out this way. And then we close the skin. So the incision is just right here, right behind the hairline. So there is, and I'm. What we sometimes do is a lot of times we'll take it and put it in a sterile bag and then freeze it. But yours was, wasn't it on? Didn't bacterial grow on it?
It was 3 tests, and 2 came back negative.
That's right.
1 came back positive, and you felt like it was okay, but...
Yeah, that's right. So, yeah. So when we do this, when we take it off and we put it in the bag, we'll test it for bacteria. There's a whole protocol. The nurses do it in the OR. And they they'll test it, and if it's, we usually do like to put the bone back. Although these custom implants are great. They're really great because you take a high resolution CT and obviously you see that, it looks beautiful. And it fits perfectly. It fits just like her bone. And it doesn't have some of the other issues, but it's a foreign body, So ideally you'd like to use their bone, but part of the processing is taking the culture, and I guess Meredith's was positive. Okay, so we do the surgery, we leave the bolt in. Of course, after the surgery, her pressures that were refractory in the 40s and 50s are now down the teens. We take her back to the ICU, and that's when I met Mom and Dad. And you guys want to talk?
Yes, I'll actually ask you to back up, Leanne, and let's go back to when you're at home and you find out that Meredith has been injured. Can you take us back there and tell me what that's like when you hear that, and how do you find out?
Well, I'd run, and I'd been planting bushes out in the yard all day, and I looked about as worn out, and we were getting ready to go to a birthday party, and they had asked if they'd go ride the horse, and I have pictures of years of them riding the horses, bareback, no helmets. These are old pictures, but this was life. When we look at these pictures now, we get sick. Just the thought of this. But I was taking a shower. We were getting ready to go to a birthday party. I'm the parent that always says, go out and play, and their video game. And I said, no, y'all go ride the horse. I've got an hour and a half, and then we're going to go. And she comes in, and she's screaming. And I'm just getting ready to get into the shower, and I can hear her downstairs. I know something's wrong. It's not the normal, she did this. I knew something was wrong. I knew it was not a normal. So she came and they had already taken, we were on the way to take the horse back to the barn when the car spooked it. She didn't know how serious it was either. She just said, Mom, I know Meredith's falling off the horse. You need to come with me. And so I immediately didn't dry off. I don't even know if I turned the shower off. And immediately threw the clothes back on I had. Shoes were outside, which is gross. And we ran. I mean, I don't know what I was thinking. I don't think I really thought. And we just ran up the road. And I get 2 driveways away. I usually can run like 4 miles, and I'm done. I can't run anymore. And so I told Jordan, you go the rest of the way, and I'll be there as quick as I can get there. And luckily, the little girl who was with her at the time's aunt swung around. She saw the whole thing, picked me up, and we went up. And then I got there, and the EMTs had not arrived yet, but the volunteer firemen were there. And the first sight was Meredith's spread eagle on the concrete with blood coming out of her ear, and 4 grown men holding her down. She was fighting with every breath of energy, and I just hit the ground and I just prayed because I knew it was bad. I just knew it was bad, and I honestly could feel the peace come through my arms and into my body, and I got up and we just went with it. And one of the first responders, it was before they arrived, they asked me, because we're Rockingham County, we're right on the line into Guilford County, where do you want to go? Well, I've only had a child with a broken arm. I don't know, where do you go? And the EMT, or not the EMT, but the volunteer fireman, ma'am, if this was my child, I would take her to Brenner's. And so I said, we're going to Brenner's. And then they arrived, and when she came, and I'm sorry, I don't remember your name, but when she arrived, I mean, she just took charge. And it wasn't like chaotic before. It really wasn't. It was pretty surreal, but it wasn't chaotic at all. But when she got there, I mean, she was calm. I mean, she was asking me questions. I'll never forget, you were writing everything down on that rubber on your glove. I mean, and I think by then I was somewhat calm because I had prayed and I had gotten the peace. And so we just kind of went with it. I mean, it was Brenner's, and it was the ambulance first, and then, no, I think we're going to take the helicopter. And my husband, he is a fireman in Greensboro, and first call, and he said it was a pretty crazy call he got, that we're going to Brenner's, and then the next call, we're going by helicopter, and so he knew it probably wasn't good, and he actually beat us to the hospital and the helicopter as well. But so, I'm glad I wasn't on that ride, actually, but it was kind of funny, I guess, but once again, I didn't know. We rode the ambulance from the driveway to the field where the helicopter was going to land, and my ride had already taken off to Winston with my other 2 daughters, and I come sitting there, and he's like, where are you going? I'm going with you. And he's like, you're not going with us. You are going to have to get another ride. And I was like, I don't get to ride in the helicopter too? And he was like, no, ma'am, you don't. So, but my ride is already gone. And he's like, well, call the ride back. So, but, I mean, I understand. I mean, it's a small, you know, they have to do what they have to do. And when I knew what all they did do in the helicopter, they would have had 2 patients on the helicopter. So, as far as that goes, but that's how it first started.
And so you come in, and you're in the emergency department. You make it up to the ICU, and maybe talk about how when you first met Dr. Powers after going through the operating room. And
well, actually, we were in the emergency room downstairs with you, and she was swarmed with staff members. I mean, Brenner's emergency room. I've heard the little advertisements about bring your princess here, and I brought my princess there. But I mean, I don't know if we were the only one there or not, but I thought every single person in that emergency room was looking after Meredith. And I mean, he told us what we were going to do, and then we did the CT scan, and when the CT scan came back that it didn't look good, then he immediately, I mean, things changed. And to begin with, they didn't know how serious. I don't think he knew how serious it was. But then after the CT scans came back, there was no question. The 6th floor, they came and got us, and then we moved in with them for a couple of weeks. So, and then we didn't actually meet Dr. Powers until after the surgery, but he immediately you don't get a lot of false hope in situations like this, and I don't think I don't want false hope. But the residents were just straight to the point. If you don't do this, you're going to die. If you don't do this, you're going to die. And I think that so when you're posed with options like that, you really don't have. I mean, what choice do you have? And I started losing my peace, I think, right when he said, you know, the skull has to be removed, and he explained how he was going to do it, and I thought, oh my gosh, this is not the peace that I had in the driveway several hours ago. And but if you look at her now, her brain did swell. Well, I don't know what all it was, but I can't imagine all that being brain. But I mean, she swelled. She really did. She's really a smart child. So. But I mean, we met. What I was going to say was, the residents were very by the book. You know, read the consent form from, you know, to consent form this, and then they explained what Dr. Powers was going to do. And I mean, I'm not a doctor, and I thought, oh my gosh, this is not the piece. But then when Dr. Powers came out, he was different. Much like the emergency room doctor, you know, this is not the end of the world. This is where we are. I'll never forget. I can't help but think my prayer and what Dr. Powers said afterwards, and he may not remember it, but he said the progression in which you got here is going to save her additional brain injury than what she already had. And I thought, additional? I mean, do we have brain injury? I mean, I just was thinking we were okay, you know, but I can't help but think that piece, and the EMS, they knew what to do, and then the helicopter and everything. Nobody was in the emergency room that night, or if they were, I just ignored it all, I guess. But, I mean, everything happened as he said. I mean, he didn't make any false promises, but it wasn't doom and gloom, and, you know, we were up there for a pretty good while. The pressure numbers didn't come down quite like we'd have hoped for right away, but, you know,
that's right.
He's here now, so.
That's right. And, you know, the time in the ICU was pretty rough the next few days, and I actually left out of town the very next day, but was keeping close tabs on her. And the trauma team, led by Dr. Prenikoff, really took care of her lungs. That was a big issue right away, because just some of the maneuvers that we do, plus there's a physiologic response of collecting fluid in the lungs when there's a severe brain injury, and so she was down for a long time. And I can't remember how long we kept her sedated and paralyzed, but it was a significant amount of time to keep her pressures down. And that, it was difficult, I remember, to keep her oxygenated, and it was a very tough road. You know, to see Meredith here today is just, it's awesome. But we treated her, got through the brain swelling. Here, this is an image that we take just the day after surgery. So this is, you know, the white here is the bone. So obviously you can see the bone is gone. You can see it here too. But this is that large bruise that's in the left frontal lobe. But the brain, you know, extends beyond the confines of the skull. And if ever you see this, you can actually just come up and touch the brain. And if they have a pressure monitor in, you can touch it and see the pressure go up. I didn't do that to you. So, and then we just, you know, after this initial surgery, then it's just treat her as aggressively as we can, you know, make sure that she's getting nutrients through a feeding tube, make sure she's getting oxygen into her blood, so we're breathing for her. You can see that the swelling starts to go down, and then the gradual process of kind of coming out of the fog starts, and that can be anywhere from days to weeks. And it's really a team effort. So, you know, we take care of this, but we're also working in conjunction with these guys and with the PICU staff. And after, you know, how long were you guys in the PICU? Do you remember?
2 weeks.
2 weeks, yeah. So that's a long 2 weeks, as everybody in here can imagine. And then, you know, once we realized that her pressures are stable in her brain, we take the bolt out. And again, the bolt can stay for as long as it needs to. And it stays as long as we can't get an exam on her, so as long as that Glasgow coma scale is less than 8. And so we take the bolt out when she starts to wake up a little bit, and then we move her up to the 9th floor. Do we have any 9th floor nurses here? They're excellent. That's our pediatric adolescent floor, and they're very unique up there, but they're fantastic to work with the teenagers. And then, we wait for her brain to recover, for her to recover, for her to go to rehab, and then we start talking about putting the bone back, and that's really it. So we get her to the point that she's ready for the bone to go back. We get another CAT scan to make sure that the brain is back in. Usually the defect is pretty noticeable, as you can imagine. So there's not any bone there, so there's no forehead. But then we, in Meredith's case, we got a high-resolution CT scan, had this implant made. This is the exact same thing. It's clear like this. We go back to the operating room just for a quick procedure to put the bone back on. That's about it.
So, when I'm no, go ahead.
I just remember waking up and seeing some older lady staring at me. I don't know why you're looking at me.
Where was that?
I was in the interview.
Do you remember most of your hospitalization?
When I'm a mom and I'm also a nurse, and I think as a nurse, I just expected when my parents would come in that they would automatically have this trust in me because I'm a professional. But as a mom, I know that doesn't always happen. So tell us, Leanne, about what kinds of things did the staff do to build that trust with you? Because you had a really strong relationship with the staff who took care of Meredith.
I still do. In fact, I think they try to run me away from the hospital. But the bottom line is you do this and you're in shock. And I would have to say that and all the staff at Printers, but I have to say the 6th floor, when parents come in, and I felt like a caged animal. I didn't know what to do with myself. You're trying to be as nice as you can. You're trying to process everything. The staff was just awesome. The nurses worked as a team. Meredith's nurses, I have to first say, and I'm not a nurse, and I get squeamish to blood and stuff, but Meredith's nurses, from the very beginning, and that was even down in the emergency room, would talk to her. They told her everything they were doing, from brushing her teeth, which she didn't like, from brushing her teeth to we're putting this heating blanket on you, we're putting this cooling blanket on you, the respiratory therapist, they told her everything. And even as a mom, I don't know that I would have thought, you're talking to her, she's asleep. I don't think I would have thought about that. Not only were the nurses awesome with Meredith, but with the family as a whole. It was a huge, I didn't know how to handle it. The nurses were very in tune to all of us as well. The first night we got up there, they went out on 911 in Rockingham County, so everybody's got a scanner in their house, and everybody knew about it. In fact, I imagine some of the people from our church were there before we were there. It was, and I say that, I love people. I like being around people. I like to talk to people, but not now. I don't care if we didn't even call my own mom and dad until the following day, because I didn't know how to tell them that she had fallen off a horse that I sent her out on and wasn't wearing a helmet. And they have always worn helmets, but never on the horse. I don't know why. But it was just a casual Saturday afternoon ride. Who falls off a horse, then. But the bottom line is the nurses could read me, I guess, they say. They knew. From the beginning, when people started piling into the emergency, to the 6th floor waiting room, I didn't ask them, but they protected me. And I didn't ask them to do that. They said, we'll tell them that you're not seeing gas. And I said, well, I hate to put you on the spot. That's our job. So all the time she was in there being looked after, and it was usually other nurses, other support staff that were dealing with us, because her nurses, especially in the beginning, were pretty busy with them. But they would let the siblings come in. The little girl that was riding the horse with her had a heck of a lot of guilt over the whole situation, and they would just let them come in, and they would just sleep in there with them, and they were just wonderful. Several times throughout the 2 weeks we were there, things would change all of a sudden, and what's going on? Why are there a million people in front of her room? And the nurse would grab me and say, let me explain to you what's going on, because I didn't know what was going on. I mean, the first time we saw her after the surgery, we went in there, and there's like 25, 30 people in that little room that's really only built for a bed and 4 people. And I mean, there's people hanging out the doors and everything. And so immediately, you know, I'm a worrier. I think, oh my gosh, cardiac arrest. And I don't remember who the nurse was, but she just grabbed my arm and let me explain this to you right now. Because I guess she could just see the fear, and I know that's what it was, because I just felt my heart. I haven't even seen her yet, and there's 200 people in this little room, so it can't be good. But by the time it was over, I mean, I will never, they will always be my friends, because they just looked after her better than I could look after her, and I knew I couldn't look after her, and they looked after all of us. And they had to tolerate a lot. We talk a lot. I think we got kicked out of the Ronald McDonald room twice as a family. I mean, we weren't the easiest group to deal with. We got a lot to say. So, but I will be around as long as I can be around, or until they just like put a sign on the door that says you cannot come in. And so.
All right, let's switch gears and talk to Jordan. Jordan is Meredith's twin. So Jordan, how was that for you, for Meredith to be in the ICU, and tell me what it's like for you as a sister.
Well, Mom said she was calm. I personally was not calm. I was crying all the way there, and she's just my twin, and I love her to death. And I can feel that something wasn't right. And it still gets me all emotional. I just love her to death, I really do. So, obviously my sleep schedule was messed up. I didn't sleep at night. The only time I could sleep is if I was with her. So I slept on the little couch by the window. And I would just talk to her. Me and Casey would, and it was just support. It was just, but the nurses were really nice. Like, I loved every single one of them. I wanted to be a nurse, I still do. And it's honestly just because of them. Like, 'cause I just want to help people like they, like they help my sister. I love them. I go, every time Mom goes, I'm right beside her. And, let's see, every time we see him, Leslie cries. And Dr. Gizian will cry, and I'll just start crying. And it just means so much to me that they were there, and they saved my sister's life. I don't know what I would be if she wasn't with me right now.
What kinds of things, Jordan, could we have done to support you more? Did you have what you needed?
I had everything I needed.
Differently for you?
They didn't tell me when to leave. I could stay as long as I wanted. And I remember, I think me and Casey fell asleep on the couch, and the baby next door was having surgery, and they didn't wake us up. And I came in there, and Mom was like, "You were asleep during the surgery," and I was like, "What are you talking about? Like, I don't know what you're talking about." And it was just nice. Like, they wouldn't just help Mom, you know, like they would talk to me too, and Casey and everybody. Like, you can just tell that they really cared about what was going on.
All right, let's go back to Meredith. Sorry. So, Meredith, once you remembered, like once you kind of woke up and you know you're in the hospital, what was really the hardest part for you while you were in the hospital?
Oh no, I hated riding in that wheelchair. I hated it so much. I hated the wheelchair. I don't know, but probably like the whole like physical therapy and stuff. I could walk, it was fine. don't know why they could make you go to that and stuff. Probably.
Okay.
Didn't like to eat, and that was a big. He may not remember it, but we were fighting the feeding tube after they removed the central. To fight her, she didn't want to eat. She wasn't hungry. She wasn't interested. And for us, and she was irritated with us, so she may not remember. It was a battle of wills. I mean, my husband would go down to the Hardee's. We were just trying to get calorie intake up. And I remember talking to Richard coming in, is that going to do it? And I was like, if she could eat this would do it for the day. I mean, because she wouldn't eat. And it was just like, oh. And I don't know if they were serious or not, but we thought they were serious about putting the feeding tube in. And it was up on the ninth floor. And I was like, come on, Steph, just eat it. I don't care if you feel like it, just eat. So that was, she got me all up about that.
That was always kind of a threat. They were like, if you don't eat, you're going to get feed tube. And I was like, no.
Are there things that we need to know about taking care of teenagers or taking care of teenage girls or anything like that you can think of?
I really can't really think of really anything, really.
Okay. So let's talk about kind of where you are now. Do you feel like you're back to exactly the way you were before the accident? We talked a little bit in the break about your senses and maybe your sense of smell. And
I hope that will come back. I really miss being able to smell everything. But I'm pretty much back to normal, I guess. But like I can't smell, so I guess that's kind of not. But I'm in marching band, so I guess marching kind of band instrument and stuff. So I guess I'm kind of normal, I guess.
Okay. Dr. Powers, talk to me about the role that you see family playing when we're in the hospital.
Did I see, what's that?
The family. How important is it that we have the family there and
involved and
incorporate them?
oh, they have to be. I mean, the feeding issue was Meredith's biggest. She just wouldn't eat, and I'd come in and threaten to drink her milkshake from Hardee's or Frosty's or whatever. And she was like, okay. I'm like, well, we're gonna have to do something about that. But certainly the family and us. I mean, I think the family is going to be there. It's really the role of our nurses and our physical and occupational therapists and how they get the family involved that makes my job infinitely easier because the families, by the time I walk in the evening on my rounds, they tell me what's going on, which is nice. It makes the job easier.
And I guess, Leanne, is there one thing, what's the one thing that you would say if you could go back and do things differently, or if you could give us advice on planning for care? What's that one thing?
Well, the first thing is the crosses wear helmets. We always wear helmets. In fact, actually, it took me forever to let her drive in a car with a teenage driver, and I was like, but I'm trying to, Dr. Powers has coached me a little bit. They're the same, treat them the same, and I'm doing okay, I think. Maybe you should ask my husband that.
She said that she should watch over me more because her head is stronger than mine, so I don't know what has to
I guess my one thing is if I could redo anything, I would redo having it happen at all. However, I have a whole different outlook on life and the importance of life now that sadly, I don't think I would have gotten any other way. But I guess if I had one thing to say, and I don't think it's negative, because in the beginning, very early on, in fact, I think even in the emergency room, you said, you probably need to call your GP. And I know that Dr. Jezian and I think Dr. Powers mentioned from time to time, I have to call your GP. I didn't, because I felt like they've got it. We don't need anybody else. We're fine. Because I really felt like everything was fine. However, after we're released, and we went to the Stick Center for 2 days, and they sent us away. Thankfully, we were the higher functioning. But after we were been removed out of everybody's care, my GP was a little apprehensive about taking her on. She still had some blood pressure issues, some dizziness, some headaches, I can't remember, there was something else, but the GP was really apprehensive about doing anything with her, especially with the blood pressure. And so I can't call Dr. Powers. She has a headache. What do I do with her? I guess I would say if you guys at Baptist and other places could kind of link in with the GP, maybe make them a part of it, and then the parents can decide. Because bottom line, I would have gone with Baptist. I would have stuck with Baptist, and I would probably move my whole entire family over to Baptist after what y'all have done for us. But I guess if I could say one thing, maybe y'all could incorporate the GPs making rounds, even though they're not our GPs, so that when it's all said and done, I feel like they're kind of a part of it. Because there's still times I really think, I just emailed Dr. Powers and asked him this, and I'm thinking, no. You know, and before she ever gets on the airplane, I will. But luckily, I don't get.
She's able to. I told you that last time.
But I mean, you know, the metal detector, I worry about everything. So, I mean, I don't want to miss my flight to Paris because we can't get through the metal detector. But I guess that would be my only thing. Is that, but bottom line is, I mean, they was not on them because they said from the very beginning, call the GP, get them involved, and I didn't. That was my call. But I would say that, you know, get your guys in there, gals in there to make the rounds in, because I would have gone and I would have stuck in with the Baptist, because now I'm kind of into the cone health, and it's weird cone Baptist thing, and I mean, I'm not talking bad about either one, but it's just, you know, it's kind of awkward, to be honest with you. So I kind of moved out into the county, and I have a doctor that will roll with Baptist or with cone, and that worked for me because I'm going to Baptist, so.
Do you guys have questions?
Any questions out there? So it's not necessarily hospital specific. It's kind of surgeon specific. I'll tell you at St. Louis Children's Hospital, which is number 6, the only difference I'd say between that hospital and our pediatric hospitals, they really think that they're the best, and they want everybody to know that. But you know, it's a great institution. You know, Washington University is a wonderful school, but they certainly carry themselves with that kind of thought. But the people that we have are every bit as outstanding. There's no question in my mind. But I can tell you, we had a very similar case in a congenital heart patient who had a problem, had an intracranial bleed, and I was the fellow, and I called in the middle of the night, and I said, hey, let's do a hemicraniectomy. And the guy on the other end of the phone said, we don't do that. I was like, yeah, we do. Watch. And so we did it, and he was like, oh, this is great. You know, and so this was just a few years ago, and so it's really, you know, I'm sure it's done everywhere, but it's kind of a surgeon-specific thing, and whether or not you believe it. And I can tell you, I've been in plenty of conversations with other doctors that say, you know, I don't believe in the whole decompressive hemicraniectomy thing. But if you talk to an Army surgeon, that's what they do. They take a surgeon or a soldier off the battlefield, bring him in, find wherever the swellings want to be, take off the skull, package them up, send them to Germany. It's a very standard thing, and they have great results.
They were pretty accepting guys. Like when I went back the second semester, I was there kind of half day, so I wasn't there the whole time. But this year I was going full time, and it's kind of had to kind of adjust to it. You weren't used to it, so I was kind of having to get adjusted to it.
Are you still having headaches?
Yes, I get them. If I don't get them in a day, that's a good day. If I don't get them in like in a day.
How do you treat that?
No one else to take ibuprofen or something.
And that handles it.
Did you have any lasting effects from the seizure? From the initial seizure that occurred, did you have recurrence?
Yeah, so initial seizures, that's a good point. So the residents, the data on this is pretty clear. An intracranial hemorrhage does increase your risk of seizures. And a lot of times, some of my partners will put patients on seizure medicines for the first 7 days. And that's what we call, it's a treatment option. So it's not necessarily a guideline, but it's an option. I don't do that because the science behind it is a little suspect, but really giving somebody prophylactic seizure medicine for those first 7 days does not change the risk of long-term epilepsy. So we call it post-traumatic epilepsy. It just decreases your risk of having seizures within the first 7 days after your head injury. My problem with it is, though, that the residents will put the patients on the seizure medicines. They'll be in for 3 or 4 days, then I'll see them a month later, and they'll still be on the seizure medicines. And they're not a benign medicine. There's really not a whole lot of data to support putting them on prophylactically. So in Meredith's case, even in the setting of her having a seizure, we stop them.
Is there a high incidence nationally, particularly in the rural areas, of head injuries related to horseback riding? And is there an initiative to get these riders educated and helmeted?
That I don't know. I would say everyone uniformly would tell horseback riders to wear a helmet. I know that's a culture that helmet wearing is done more of kind of the proper riding than helmet after that. All right. That's it. Hey, thanks guys.